Blood transfusion. Indications. The commonest indication of blood transfusion is during acute hemorrhage, be it external or internal. It is indicated during certain major operations where a good amount of blood loss is inevitable. Example, radical mastectomy, abdominoperineal resections. In case of deep burns, blood transfusion is indicated beside initial fluid and plasma administration, as there it considerable haemolysis and destruction of RBCs. Preoperatively, blood transfusion is required when patient is already anemic and there is no adequate time for iron replacement therapy before operation. This is particularly needed before operations for malignant diseases. In postoperative cases, blood transfusion is required when the patient has become considerable anemic and debilitated either due to excessive bleeding during operation or as a result of infection or septicaemia. In anemic patients, particularly when the hemoglobin level is below 10 grams per 100 ml, blood transfusion is often indicated to treat anemia. It must be remembered that in chronic anemia, it is better to transfuse packed cells rather than whole blood to reduce more burden to the already burdened heart due to hypervolemia. In severe malnutrition and hypoproteinemia, blood transfusion is indicated before any type of surgery. In certain coagulation disorders like hemophilia, Christmas disease, thrombocytopenia, purpura, etc. Blood transfusion of blood fraction transfusions are required. In a few blood diseases, example Hodgkin disease, leukemia, aplastic anemia, whole blood transfusion is required. In treating cases of erythroblastosis fetalis due to RH incompatibility, exchange of transfusion often performed through umbilical vein of the newborn baby. During chemotherapy for malignant diseases, blood transfusion is often indicated if the routine blood examination shows considerable diminution of RBC level.